is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. As Nigeria joins the rest of the world to mark 2021 World AIDS Day, the Gombe State Agency for the Control of AIDS said no fewer than 5,340 children are undergoing treatment for HIV and AIDS in the state, out of 31,450 persons with a viral condition. Also, the National Agency for the Control of AIDS, Nigeria, stated that the country recorded 86,000 new HIV infections and 49,000 deaths from HIV-related illnesses in 2020. And speaking on the need for a global action to end HIV and AIDS infection, Dr. Nnamdi Ndi Ezuma and Dr. Linda Odige called for more awareness to contain the spread of the virus.
The day that has been selected for us to create more awareness on the possible ways of prevention of this condition and also reduction of its rates of spread. You know, there's always that tendency to be lax about taking daily medications and drugs, but people should I think their awareness should be more, so that people get to know that this condition is something that for now has no cure, but you can actually live with it and continue your life fully. So having that awareness that the moment you stay off your medications, you are prone to, ending your life. It's very important that once people are, and in fact, that's the reason why we have this day, to talk to people that those that are already on drugs, continue taking your drugs. Those that are not yet on drugs, seek where you can get these drugs from, and they are free. They are not drugs that you actually pay for. And those who don't have, these are the possible ways to prevent yourself from getting infected with this condition.
AIDS is still there, just like malaria, but it's just that now there are better preventive measures, education, and people are aware. But then people should not still, people should not be promiscuous or just live their lives, let their guards down as if it's not there. HIV/AIDS is still.
This is coming even as the World Health Organization announced that despite the commitment to end AIDS by 2030, an additional 1.5 million new HIV infections was recorded in 2020, adding that 37.7 million people are now living with the health condition. And as the world marked World Disability Day, the United Nations Children's Fund, UNICEF, has disclosed that 240 million children living with disabilities all around the world are being denied basic rights, adding that the figure indicates that 1 in 10 children worldwide suffers from denial of basic human rights. UNICEF stated this in a report titled Fact Sheet. The world's nearly 240 million children living with disabilities are being denied basic rights, which was released ahead of the International Day of Persons with Disabilities. Gombe State Commander of the National Drug Law Enforcement Agency has lamented the increase of psychotropic substances in the state, adding that it has an overwhelming influence on users. The state commander, Ekaite Ogunwoke, made the disclosure in Gombe during the implementation of the National Security Sensitization Program against political thuggery, kidnapping, drug abuse, radicalization, and violent extremism, organized by the National Orientation Agency. And the World Health Organization Director General Dr. Tedros Ghebreyesus has said cases of the new Omicron variant of the coronavirus have been reported in at least 23 countries in 5 of the 6 WHO regions. According to the WHO latest weekly epidemiological update on COVID-19, preliminary evidence suggests Omicron may have potential immune escape and or possibly higher transmissibility when compared to previous variants of concern. And South African president meets with his Ivorian counterpart in Abidjan as he continues his tour on the West African states. Ramaphosa criticized pandemic health apartheid, which he described as a slap in the face of African excellence and expertise. Recall that the South African scientists announced on 25th of November that they had detected a highly mutated form of coronavirus. And this is TOS Television Network. You're watching Health 54. Welcome back. Just 2 days after introducing a travel ban on flights from the Southern African region, including South Africa, Eswatini, Lesotho, Botswana, Zimbabwe, Mozambique, and Namibia, the Canadian government has now expanded the ban and announced additional strict border measures to reduce the risk of the importation of COVID-19 and its variants like Omicron into Canada. And the Federal Ministry of Health has convened a special National Council on Health meeting where all state commissioners of health and other stakeholders in the health sector will review the gains and lessons learned from COVID-19 management towards building a more resilient health sector in Nigeria. At the opening of the two-day NCH meeting in Abuja, the Minister for Health, Dr. Osage Ehanire, said that Nigerians must remain alert as new variants of the virus, which are more contagious and virulent, power new waves of infections. The Medical and Dental Council of Nigeria has said all medical graduates who schooled abroad and seek to take its council's assessment examination would undergo a 6-month mandatory attachment program. Applicants who are Nigerian citizens are required to pay a non-refundable fee of 900,000 naira, while non-citizens are to pay 1.4 million naira for the program. The council also added dental candidates will have to pay additional charges of 200,000 naira for training materials. The board of Gavi, the Vaccine Alliance, has approved an investment to support the malaria vaccine introduction, procurement and delivery for Gavi-eligible countries in sub-Saharan Africa in 2022 to 2025. An initial investment of $155.7 million for 2022 to 2025 will initiate the implementation of these additional tools in the fight against malaria. The introduction of the RTS as malaria vaccine to currently recommended malaria control interventions could help drive down child mortality in Africa. And the Nigerian Medical Association has called on the country to prepare for possibly fresh and deadlier Lassa fever, Ebola virus disease, and COVID-19 outbreaks. Its president, Professor Innocent Tuja, at the opening of the December National Executive Council meeting in Sokoto, expressed concerns over emerging and re-emerging infections. He stressed the need to continually put together effective outbreak prevention and control measures that are continually appropriate, relevant, and feasible for communities to check unnecessary loss of life and minimize disruptions to essential services. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.